Hello everyone, welcome back to the Mass Retirees Weekly Update. Today's Friday, November 22nd. I'm Sean Duhamel. Thank you so much for joining with us and tuning in again this week. Now I've got two major issues or items to cover for you this week. One is on healthcare. The second is an update on the current status of efforts in Washington, D.C. to end the Social Security WEP and GPO laws. But before I get into those issues, just two quick housekeeping items. First and foremost, a reminder for all of you that today at 11 a.m. we will be holding our annual South Coast Area Membership Meeting. It kicks off at 11. It is once again at Whites of Westport, very conveniently located. The Westport meeting is one of our most popular meetings. We have a lot of retirees living in and around the South Coast. So if you're in the area, if you don't mind taking a little bit of a drive, come on over, say hello. The meeting's going to run till about 12:30 or so. We'll then have Q&A and door prizes. You're welcome to bring a guest, and as always, our meetings are open to all Mass Retirees members. Secondly, and just as important, if you're watching this video on Facebook or on YouTube, please take a moment to not only like our pages, but follow us on these social media platforms. It gives you the ability to get instant access to breaking news. If you're following us, chances are news items will appear in your feed. Hopefully this is important information for you. And also, if you're watching this and you're not currently a Mass Retirees member, please consider joining. We have two levels of membership. One is for public retirees here in Massachusetts. You could be a full member of our association. The second tier is an associate membership for active employees who are nearing retirement age and would like to utilize our publication and weekly updates and other information that Mass Retirees publishes as a resource for you to keep you better informed and help you to better prepare for your retirement. You can join online at massretirees.com. The buttons to join are right up in the banner at the top of the page. We're strength in numbers, so please, if you're enjoying the material we're sending out and you're not a member, please consider joining and being part of this great association. So to jump right into things, there is a lot going on, and we continue to say that, but it seems like every time we turn around, there's just one more thing added to the list of items that we're currently working on. Now, one of the things that you have heard us very frequently refer to over the past couple of years, whether it's in our weekly updates, in The Voice, which of course is our newsletter, or in our recruitment materials, if you're a new member of our association, you've probably seen us refer to our concern over rising healthcare costs. Now, this is of no surprise to anyone, or at least it shouldn't be. Over the past couple of years, we have seen a stark rise in healthcare costs, not only here in Massachusetts, but all around the country. And this comes after a good 10 or 15 years of relative calm within the healthcare marketplace. Now, by calm, I don't mean that there weren't any increases. There are almost always going to be an annual increase in insurance premiums and occasional increases in out-of-pocket costs like copayments and deductibles. But those increases over the last decade or so were relatively minor and a little bit easier to manage. Now, obviously, in a perfect world, we don't want to see any increases at all. If we had our way, we'd see a reduction in what you're spending out of your pocket to access that very critical and needed care. But the reality is that the price of healthcare, just like the price of most things, is going to continue to go up. What's important, however, is how much is it going up and how quickly is it going up. And we've entered a point now where people all across the country, including officials right here in Massachusetts, and we certainly hold this belief that we have entered into a crisis of affordability when it comes to healthcare. Whether it's monthly insurance premiums, out-of-pocket costs, the copayment, the deductible, it seems that every time we're turning around, we're paying more and more and more out of our pockets for either the same or in some cases even less quality services than we used to get. And at the same time, the healthcare system continues to become more complicated, more confusing, harder to access, and it's creating really a crisis across the board for all of us. Nancy McGovern and I, when we were in Washington, D.C. just 2 weeks ago, attending the annual conference of the Public Sector Healthcare Roundtable, which brings together all of the public sector health plans from across the country. So essentially all of the GIC type plans from all across the country. One of the major themes at that conference and topics over 2.5 days was healthcare affordability and cost increases and what is being done out there across the country to try to address this and address it in a way that doesn't shift more and more of the cost burden onto you to pay the price, or that is going to lower the quality of the benefits that you have. And that's the challenge, trying to balance controlling costs without doing harm to the very benefits in plan design that all of us depend upon. No one knows when you're going to have to access our healthcare system. You could be healthy as a horse one day and have something happen the next day, and suddenly you're dependent on affordable, good quality benefits that you can access to get the care that you need. So here in Massachusetts, this has become a greater and greater problem. And the GIC, the Group Insurance Commission at the state level, has begun talking about it. Blue Cross and Blue Shield, Point 32, which is the parent company of Harvard Pilgrim and Tufts, all of the plans across the state to varying degrees have been talking about this. Now, earlier this year, we reported on a survey that was conducted and published by Blue Cross and Blue Shield of Massachusetts that found some pretty startling results and pretty shocking results, but we really shouldn't have been surprised at the same time. What it showed is that 2/3 of those 1,000 Massachusetts residents that were surveyed are concerned, very concerned, about healthcare affordability. But most shockingly and most disturbingly, it found that 40% of those surveyed has said that over the past year, they have foregone accessing needed healthcare services because they couldn't afford to pay the price for it. So they didn't go to the pharmacy and get a prescription filled because they couldn't afford it. They didn't have a test done because they couldn't afford it. They didn't go to a doctor's appointment because they could not afford to do so. Massachusetts is one of the wealthiest states in the country. The income here in the state across the board on average, I believe, is higher than maybe any of the other states. If we're not the highest, we're one of the highest. It is completely unfathomable that those types of conditions would exist, that 40% of our citizens in this state, our friends, our family, our neighbors, our members, can't access the care that you need because you can't afford to do so. That's a crisis, and it's only getting worse. And we have been reporting that the Medicare supplement plans at the local level, those costs have risen considerably for 2025. We do not yet know the GIC costs and plan design. Those decisions are yet to be made. But at the GIC's meeting just yesterday morning, Executive Director Matt Vino, amongst others, began to ring the alarm bell pretty loudly that this is a crisis that is currently here and it's only going to get worse if we do not collectively find a way to deal with it. Now, you may be asking, what is driving all of this? Well, let me tell you first of all what is not driving it. You are not the cause of this. And what I mean by that is it's not being driven by an increase in utilization or even an increase in our aging population. We do know that here in the United States, we have an aging population, which is costly in terms of accessing medical care. But that's not what's driving these cost increases. What is driving it are really two main factors. One, the continued excessive rise in prescription drug costs. The United States is one of the, if not the only, Western country that, for the most part, does not put any cost controls on what is being charged by pharmaceutical companies for their products. Most of the rest of the world, and certainly all of the countries that we think of when we talk about the Western world, whether it's Great Britain, France, Germany, Israel, any of the major European countries, and most of the world puts cost controls on what can be charged for these products. But here in the United States, with very few exceptions, they can charge us whatever they want. The free market dictates the price, and we're stuck paying it. Now, there are some exceptions, and as we've been reporting in our newsletter, Under the Medicare program, for the first time ever, Medicare is legally allowed to negotiate the price of a certain number of drugs. And there will be more drugs hopefully coming on the market or being available to be negotiated in the coming years. And hopefully that will help contain or control the costs under the Medicare program. And we're very hopeful that that will continue, and we'll continue to report on it. But absent that, it's really the Wild West out there in terms of pricing. The other major contributing factor is just general medical inflation. The prices of medical services being charged by hospitals and doctors continues to rise at a pretty rapid clip. And you've probably seen in the press, you may have received a letter from the hospital system or maybe a doctor's office that you received some care at, saying that they're locked in some pretty heated negotiations with some of our healthcare plans. That type of situation most likely is going to get worse before things get better. The health insurance carriers are hard pressed to control costs while also meet the demands of hospitals and doctors who want rate increases. So it's this constant push and pull struggle with the enrollees, you being stuck right in the middle. And this really affects all of us. So in addition to the GIC's presentation and the comments by Executive Director Vino, the Commission also heard from the Healthcare Policy Commission, the HPC, and David Seltz. This is the third consecutive year that David and the Healthcare Policy Commission have made a presentation to the GIC. It's based on their annual report and cost analysis that takes place. They do fantastic work. HPC, which has been in existence for 12 or 13 years now, was really the first of its kind in the country when it was created, and now several other states have followed Massachusetts' example in creating similar agencies within their own state. In addition to research, HPC is also tasked with trying to find ways to gain control over costs. And David explained in his comments, or echoed, Matt's concern and the concern we're having hearing from the insurance carriers and nationally of these problems. And as we report in our weekly message today, which if you are a member of Mass Retirees, you will receive every Friday morning at 6 a.m., a very detailed email, written email comes out with this video embedded in it, getting a little bit more into the weeds of the topics that we're talking about. So if you're a member, look to today's email. And if you're not receiving the email, reach out, let us know. I want to make sure that we have your email address on file and that it's not getting lost in your spam filter or things like that. So let us know. But David's comments are contained in today's email message, along with a link to the annual HPC report for those of you who are interested in reading more about this directly. But at the end of the day, what this is going to take in order to get control of, at least here in Massachusetts, is us working together. And we have continued to partner with companies like Blue Cross and Blue Shield in Massachusetts. And yesterday, Nancy McGovern, while the GIC was meeting and I was focused on the GIC, Nancy attended the Blue Cross and Blue Shield's Labor Advisory Committee board meeting. Much of what the GIC was talking about, Blue Cross was also talking about at the same time, along with some innovative programs that they're involved in, trying to find ways to improve the quality of health as well as lower healthcare costs going forward. So it's going to take a combination of innovative ideas and new approaches, changes being made through the legislative or regulatory process by government agencies, along with just a new way of thinking from healthcare providers, hospitals, doctors, other ancillary healthcare benefit providers need to come together, address these issues, and find new ways of providing these services going forward. Because as David spelled out, and we wholly agree with him, the current path that we're on is simply unsustainable. You can't afford to pay more. The government can't afford to pay more. The taxpayers, private sector employees and employers cannot afford to continually be paying more. We've got to find a new way to go about this. So with that, let me shift over to what's happening in Washington with full repeal of weapon GPO. As you know, we reported last week that H.R. 82 passed the House of Representatives about a week and a half ago now. It is now before the U.S. Senate. we are calling on Senator Chuck Schumer, the Senate Majority Leader, to schedule a vote on either H.R. 82 or Senate 597. The two bills are identical. One was filed in the House, the other in the Senate. If either one of them is passed by the Senate intact with no changes, the legislation would then go to President Biden, who has promised that he would sign the bill. But we need to get it to the president prior to the Congress adjourning for the year on December 20th, and the clock is ticking. Now, we're disappointed that that vote did not take place this week. I'm recording this late Thursday afternoon, so maybe with a stroke of luck, on Friday, the Senate will take this up. But as far as we know, there is no scheduled vote on these issues this week. We have yet to hear from the Senate leadership, whether it is Senator Schumer or Senate Republican leader Mitch McConnell, on what their view is on this, on these issues. Now, Senator Schumer is a co-sponsor of Senate 597. Senator McConnell is not. In the past, Senator McConnell has adamantly opposed full repeal of weapon GPO. We do not know if he has changed his position on the issue or not. He simply has not publicly said. However, we're doing everything we can to help to encourage and advocate for the Senate to act on this bill, this issue, before the clock runs out on December 20th. If December 20th comes and goes and no action is taken, then unfortunately the bills will be dead. They'll have to be refiled again in 2025, and the whole process will start over again from the starting line. We want to avoid that situation if at all possible. So in addition to the efforts of our association, there are countless groups, whether they be retiree organizations, the public employee unions, individual retirees, various online advocacy groups that have sprung up over the last few years. All of us are working toward the same goal of getting the Senate to act in the time that is remaining. Now, as of now, we have 61 solid votes or solid commitments who have signed on as co-sponsors or the lead sponsor of Senate 597. Now, we don't know if that vote count, that 61 vote count, is real or is not. What I mean by that is at times legislators, congressmen, senators will sign on to a bill because they believe it has merit and that it should be considered, but that doesn't necessarily mean that they are going to support it when it comes up for a vote on the floor. The only way to know that for sure is to bring the bill forward and let the chips fall where they may. And at this point, that's what we're asking for. Schedule a vote, let the chips fall where they may. In the meantime, we're going to continue to do everything possible to advocate to get this passed. And what that means is if you haven't already done so, contact your 2 U.S. senators. Google them, look up who they are, contact their offices. You can use the forms that are the contact forms on their website. In your own words, just briefly explain who you are, that you earned a Social Security benefit that you paid for or that your spouse paid for, and that you are unfairly denied that benefit as a public retiree, and urge them to prioritize a vote in the passage of this legislation in 2024. Now, in the meantime, we've seen an increase of activity from those who are opposed to full repeal. We provide links to the articles that have appeared in the press over the last few days within today's weekly message. We do not agree with some of the characterizations that are being used as to why this is a bad idea, but it really goes back to the original intent of weapon GPO and the reasons that opponents have used to not allow for this legislation to advance in the past. There's a reason why it's been 41 years that we're still fighting over this and talking about it. If this was easy to resolve, it would have happened many, many, many years ago. But we're cautiously optimistic that we have momentum on our side and that we can get this done this year and finally bring all of you the relief that you have earned, and you have been very, I don't want to say patient, because I know there's a lot of anger out there and it's well-placed anger, but that you have been waiting for far too long. So we're going to continue to do our part. We'll keep you abreast of everything that's going on. Thank you to those of you who have taken the time to get personally involved in this. I know that many of you have reached out to me directly, letting me know what you're doing, and some of you have direct access and relationships with U.S. senators, and by all means use those connections to help us get this done. And collectively, hopefully we'll be successful. But with that, I'm going to log off for today. Again, if you're in the South Coast area this morning, come on by to Whites of Westport, say hello. It'd be lovely to see you in person. In the meantime, have a good day, everybody. Bye-bye.